There's an odd dynamic that happens to us when we're close to people. We don't always notice when they're in serious trouble. Things we notice immediately about a perfect stranger don't register on us with people we love. We just tend to make accommodations and excuses for the troubled or even weird behavior of people we care about. In today's video, we will be showing you some warning signs of depression. Number 1. Sleep disturbance. Having a change in your sleeping patterns can be a warning sign of depression. Now, this can be insomnia, where you're not able to fall asleep, or you're not able to stay asleep for long periods of time, or it can be hypersomnia, where you're sleeping for long hours, many more hours than you normally do. Number 2. Change of appetite. A change of appetite leading to unintentional weight gain or unintentional weight loss can also be a warning sign of depression. You may find yourself eating in excess, trying to comfort yourself for feeling depressed, or you may find that you have no appetite at all. Either way, a change of appetite can be a warning sign of depression. Your appetite may also tend to decrease when you're sad, depressed, grieving, or anxious. Boredom and stress have also been linked to a decreased appetite. Eating disorders, such as anorexia nervosa, can also lead to a decreased appetite overall. Number 3. Loss of interest. If you or a loved one is experiencing a loss of interest in things that you normally like to do, things that normally gave you pleasure, all of a sudden you have no interest, well, it could be a warning sign of depression. For example, if you are someone who loves sports, you live for watching sports, but all of a sudden sports don't make you happy. Or if you're a person who loves to dance, play the guitar, or if you like to play piano, or if you're a painter, and all of a sudden these things just give you no pleasure at all, then this loss of interest and this inability to find joy in things that normally gave you joy could be a warning sign of depression. And for parents, you really want to make sure that you pay attention to your children, especially your teenagers, because if they all of a sudden have lost interest in things that normally gave them joy, it could be a warning sign of depression in them. Also, look at a change in teenage habits. If they have a certain group of friends who have common interests, but all of a sudden they get a totally different group of friends, and it really doesn't seem to make sense to you, pay attention. It could be a warning sign of depression. Number 4. Irritability or unwarranted emotional outbursts. People who are depressed tend to be very irritable. Things that seem minimal that normally would not have bothered them, things that would not have gotten on their nerves, will all of a sudden make them very bothered, very irritable, and it can lead to unwarranted emotional outbursts. They can develop anger management issues, where things that you think typically would not upset them, all of a sudden have them screaming or lashing out. Angry outbursts. And it can also be emotional in other ways. They could cry more easily. Things that you normally think would not upset them or lead them to tears can cause them to cry. They can become much more emotional in a way that doesn't always seem warranted based on that person's baseline. So if you or a loved one is experiencing irritability and unwarranted emotional outbursts, it could be a sign of depression. Number 5. Anxiety. Anxiety refers to anticipation of future concern and is more associated with muscle tension and avoidance behavior. Fear is an emotional response to an immediate threat and is more associated with a fight or flight reaction, either staying to fight or leaving to escape danger. Anxiety can be a sign of depression. Be sure to watch my YouTube video on 5 types of anxiety disorders. Feeling tense, nervous, or unable to relax. Having a sense of dread or fearing the worst. Feeling like the world is speeding up or slowing down. Feeling like other people can see you're anxious and are looking into you. Number 6. Lack of focus or difficulty concentrating. If you find that you are having difficulty concentrating, not able to complete tasks at work or tasks at school the way you normally would have, or maybe you're seeing this in a loved one, this too could be a symptom of depression. Also, if you find yourself being more forgetful, not being able to remember or concentrate on things that are important, it could be a symptom of depression. Number 7. Substance abuse. Substance abuse is the medical term used to describe a pattern of using a substance, drug, that causes significant problems or distress. This may be missing work or school, using the substance in dangerous situations, such as driving a car. It may lead to substance-related legal problems or continued substance use that interferes with friendships, family relationships, or both. Substance abuse, as a recognized medical brain disorder, refers to the abuse of illegal substances, such as marijuana, heroin, cocaine, or methamphetamine. If you find yourself drinking more alcohol than normal, drinking excessively, or doing drugs, and you're basically trying to numb emotional pain, this also can be a warning sign of depression. Substance abuse is the medical term used to describe a pattern of using a substance, drug, that causes significant problems or distress. This may be missing work or school, using the substance in dangerous situations, such as driving a car. Number 8. Poor hygiene. Poor hygiene can certainly be a sign of depression. If you know of a loved one who normally has pristine hygiene, hair's always combed, teeth brushed, they always smell fresh, clothes neat in a certain way, if all of a sudden they're disheveled, not wanting to shower, and they don't care about their appearance, this can be a symptom or warning sign of depression. Poor hygiene is having bad or non-existent self-care that can lead to a messy appearance and health concerns. Having poor hygiene can be an indicator of other problems, like neglect. Generally, hygiene concerns should be resolved as quickly as possible. Number 9. Preoccupation with being victimized or a preoccupation with one's own mortality. If you have a loved one who is constantly talking about being victimized, no matter what the scenario, they're always the victim. People are after them. People are trying to hurt them. They're always on the bottom of the totem pole, or woe is me. If you're noticing more and more of that in your friend or your loved one's behavior, it could certainly be a warning sign of depression. Or if you have a friend or a loved one who is developing a preoccupation with his or her own mortality or death, if they're saying things like, "This world would be a better place if I weren't here," or "You guys are going to miss me when I'm gone," or if they're constantly talking about death or life without them in it, then this could be a major warning sign of depression. Number 10. Irritability. Irritability is a feeling of agitation, although some describe agitation as a more severe form of irritability. Regardless of the term you use, when you're irritable, you're likely to become frustrated or upset easily. You might experience it in response to stressful situations. It may also be a symptom of a mental or physical health condition. Babies and young children are often reported to feel irritable, especially when they're tired or sick. For example, children often become fussy when they have ear infections or stomach aches. Adults can also feel irritable for a variety of reasons. If you feel irritable on a regular basis, make an appointment with your doctor. You may have an underlying condition that requires treatment.